Hi, everyone. My name is Kira, and I'm an ICU nurse in Salem, Oregon. And I'm going to talk to you about my personal philosophy of healthcare and nursing. So, when I think about what it means to be a nurse in regards to ethics, policy, and legal perspective, my mind goes a million miles a minute in many different directions. First, in regards to ethics, I feel that I hold a high ethical standard for myself and everybody around me. I also held a high ethical standard for my patients, and sometimes that can be a little frustrating because we know that we aren't always respected by our patients and their families. Honesty, respect, and accountability are just a few of the standards that I value and believe are essential in providing optimal care. When my colleagues around me act in this way, then I feel like I can do a better job taking care of my patients, and we have better teamwork altogether. These values, I believe, help us as nurses to adhere to policies that aim to protect the patient, the nurse, and the facilities that we work for. If you are honest and practice with integrity, then you'll improve your work environment, allowing safe and quality healthcare for everyone. If you are respectful, then you will treat the patient and all of those individuals around you with a dignity, worth, and will appreciate the unique characteristics of everyone. If you are accountable for your actions, then you will make decisions to the best of your ability and feel obligated to promote health and provide optimum care. Upholding standards of care and maintaining an ethical practice should prevent you from ever running into real conflict that can jeopardize your practice, although we know that this isn't always the case. Even with the highest standards, a nurse can often find themselves in difficult situations surrounded by legalities. From medication errors to incomplete documentation, we must conform and adhere to the policies that guide us to prevent legal implications. Really, as a nurse, it seems as though there are endless standards to adhere to no matter how difficult the circumstances. Like, even on a busy road, when you have dozens of cars around you and it's stop and go, you still have to adhere to the rules and the laws to make sure that everything goes smoothly. I started my career as a nurse 7 years ago in a level 2 trauma center intensive care unit. There we have a 30-bed ICU and we see everything from pneumonia, sepsis, head traumas, CVVH. We kind of get a little bit of everything. Working there, I feel like I've seen everything. And then I go to work and then I learn and see and do something new. In the ICU as a nurse, I've seen some really incredible things that I'll never forget. One time I was the nurse of a teenager who drowned crossing a river a few summers ago, and I went down to the OR with him for organ donation and I watched his last heartbeat. I've watched a wife beat on her husband's chest, crying for us to do something for him when he went into VTAC and his heart stopped. And we were just supporting his wishes. He was adamant he wanted to be a DNR, and she wanted us to do everything. So, despite our best intentions to conform to the policies and standards, our field of work in nursing is so crazy, emotional, and chaotic. And it can be easy to make a mistake that can jeopardize your license, doing something like a medication error when you don't even know it. So, with all of the pressure that we're under, how do we not just collapse? I know for me personally, I don't do anything that I'm not comfortable doing. I try to be as honest as I can and communicate as best as I can with my patients and my care team. So when it gets so chaotic and task oriented, we kind of forget why we got into nursing in the first place. So there's something that I did at our hospital recently to kind of bring it back down um, to what got us started in the beginning. So, one of the things that I've started at my hospital is after a failed resuscitation on a patient during a code blue, the entire care team stops and pauses for 30 to 60 seconds for a moment of silence honoring the patient. I think from doing that, we've learned a lot about what we used to do. And, the patient dies, we throw a sheet over them, we wrap them up in the body bag and send them to the morgue. And then we get on with our next task and we don't really think about what just happened. I think this has helped us to not look at nursing as a job, but as a privilege. And practicing with a high ethical standard and caring for people is what we're meant to do. So that concludes my personal philosophy of healthcare and nursing. And I feel like if you take care of the patient to the best of your abilities and you practice with honesty and integrity, that you will go very far and be a successful nurse.